So this is to talk about the HPO axis. For some reason, this has always given me a little bit more trouble than other axes like the HPA axis. And by HPO axis, I mean hypothalamus, pituitary, ovarian axis. But I think if we go through, in this video, the follicular phase, another video on the luteal phase, both in the case of with pregnancy and without pregnancy, and then if you can match that up with what's happening in terms of histology in the with ovarian follicles and also changes going on in the uterus, you should have a pretty good understanding of this, and there really isn't all that much to know. So here's our follicular phase diagram, looking at the early part of this. Here we got the hypothalamus releasing GnRH, gonadotropin releasing hormone to the pituitary gland, which causes the release of the gonadotropins. So that's LH and FSH coming from the anterior pituitary. So like always with pituitary, if you have to know what's releasing what, just remember what's coming from the posterior, because there's only two of them. That's the oxytocin and the ADH. So if it's not oxytocin or ADH, then you know it's coming from the anterior pituitary. So these anterior pituitary gonadotropins go to their respective cells in the ovary, LH working mainly on the theca cell and the FSH on the granulosa cell to cause their effects. And since we're in the follicular phase, what's going on here, the whole sort of point of this is the first 14 days of the cycle, and the idea is to get ready for ovulation. So there's sort of two things that has to happen. One is preparing one ovarian follicle, developing it to mature it so that it can ovulate, and the other part is getting the myometrium and endometrium ready for ovulation. And the important hormones here, the main one is estrogen in the follicular phase, and also FSH. And so you've probably seen diagram something like what I'm drawing here with all these hormones, the LH, FSH, estrogen, all those things in the follicular phase and the luteal phase. And so just looking here at the first part, the follicular phase, what happens is you have a little bit of a bump in FSH going on, and you have this sort of steady rise in estrogen as it's being made here from the granulosa cell, as you can see. And then when the estrogen production reaches its max up here at the top, it's not really going to go any higher. It has sort of a change on the upstream impacts. So normally estrogen has a normal type of negative feedback mechanism on the pituitary gland and the hypothalamus. But once it gets to above a certain level, it changes, and it actually has this sort of positive type of feedback, and that leads to what's called the LH surge. So the LH hasn't really been doing much along here. It's just been kind of hanging out, and then once estrogen peaks, the LH and the FSH both increase because the estrogen, instead of being inhibitory towards this pituitary and hypothalamus release of their hormones, it actually stimulates them. So then we have the LH and the FSH do their little surge, and that's how you know that you're getting right to ovulation. So we should be able to see that here in the graph. So we have the change. It starts stimulating. Then we have the LH surge, and that's how we know that we're getting to the end of the follicular phase and the ready for ovulation and the luteal phase. So that's the end of this video. Watch the luteal phase and the histology stuff about the changes going on there, and you should have a pretty good idea about how this works. So just as a recap, we got the FSH working on the granulosa cell, making estrogen with the enzyme aromatase. All those are pretty much just have to memorize those. The granulosa cell also makes the inhibin, which feeds back in a negative manner. The LH works on the theca cell, makes more androgen to get transferred over to the granulosa cell and to go along in this process of making lots of estrogen. Then you just have to know that the high estrogen, the peak estrogen, is what precedes the LH and the FSH surge, and it has this changed upstream behavior to cause the surge, and then you know you're at the time of ovulation once you get to there. I think that covers everything, and that's the end of this video.
This video talks about the luteal phase. And before we go into that, I just want to do a quick recap of the follicular phase, because you have to go through the follicular phase to get to the luteal phase. So we have the follicular phase, that's pre-ovulation, ovulation, luteal phase. I'm sure you're sort of familiar with seeing diagrams, something like this. And so in the follicular phase, the two sort of goals of it are to recruit a bunch of follicles, stimulate them, have one of them ovulate, and also prepare the uterus, specifically the endometrium and the myometrium in the uterus, to get ready for a possible implantation of a blastocyst in the pregnancy that would start in the luteal phase. And the important hormone of this follicular phase is estrogen. The estrogen is made by granulosa cells, and the important enzyme involved in that is called aromatase. So with that background in mind, we move on to the luteal phase. ovulation has occurred, and then there's two sequences of events that can happen here depending on if there's a pregnancy or if there's not a pregnancy. So we'll start with the no pregnancy scenario. So we have the anterior pituitary making its gonadotropins LH and FSH, and those act on the remnant of the follicle. So you have the follicle with the egg in there, and then it ovulated, and then there's a remnant left over. So the gonadotropins act on that remnant to turn it into corpus luteum. Corpus luteum is important because it makes the progesterone. It also makes estrogen. And if we take a look here at our diagram of the luteal phase, you can see that in the beginning of the first half of the luteal phase, you see progesterone production and also estrogen increasing. And that's as the corpus luteum develops and grows under the influence of LH and FSH. But like most these endocrinology hormones, there's a negative feedback loop back up here with the pituitary hypothalamus. So you have this progesterone and estrogen increasing, and they negatively feed back to the LH and the FSH and cause those to decrease. And so at some point in the luteal phase, the LH and the FSH aren't stimulating the corpus luteum enough to keep it growing, to keep it alive, and it actually atrophies and goes away. And so that's reflected here by the decrease in the progesterone and the estrogen. And then at the end of the luteal phase, you have the progesterone and estrogen decrease to the point where there's menstruation that allows the LH and the FSH to increase because they're not being inhibited as much anymore because these levels are very low, and start to recruit the next set of follicles and go on into the next cycle. So that's the no pregnancy situation. So if there is a pregnancy, the main difference is that you have this the blastocyst implant, and you have beta HCG production. The beta HCG production actually starts a little bit before implantation, but you have the beta HCG production, and this is very structurally similar to LH. And so instead of having the corpus luteum atrophy and go away and progesterone and estrogen production go down, you have the beta HCG maintain the corpus luteum, maintain production of progesterone and estrogen, especially progesterone, which is very important because it allows the pregnancy to keep going, and that occurs for the first 8 to 10 weeks under the influence of primarily the corpus luteum, and then the placenta takes over those functions. So the placenta starts making beta HCG, and the placenta starts making progesterone, and that occurs after 8 weeks, and by the end of the first trimester, the placenta has taken over those functions. And so the endocrinologic properties or functions of the placenta are kind of important to know about. And so the placenta makes beta HCG, which production peaks around week 8 and sort of slowly decreases and isn't super important, but also makes the progesterone. And so where the histology tie-in for this, you can see that in histology. We'll just go over it real quick here. You have the blastocyst implant to the uterus and has an outer layer called a trophoblast. And this trophoblast differentiates into 2 different types of cells. And so one of them is called the syncytial trophoblast. So that's the outer layer. And there's also this cytotrophoblast, which is the inner layer. The syncytial trophoblast, the outer layer, is the one that's active and is making endocrine function, has endocrine function. So it makes the progesterone and also the beta HCG. And then that's the SYN layer. And then the inner layer, the cyto layer, doesn't make hormones, but it's the stem cells, and it also very important in the implantation and invasion of the blastocyst into the uterine wall. So that is the lecture about the luteal phase, and that's the end.